My dear doctors, good morning everyone. FMGE NEET-PG students, let's start our chanting session. Parts of the human eye. Parts of the human eye. Cornea. This is cornea. What is the function of cornea? Protects eye, refracts light. This is iris. This is iris. Colored muscle regulates pupil size. Optic nerve, retina, sclera, ciliary muscles, vitreous body. This is lens. This is aqueous humor. Okay, this is aqueous humor. Okay, aqueous humor. What is the function of ciliary muscle? This is the ciliary area, ciliary region, ciliary pupillary region. This is iris, pupil, sclera, lacrimal caruncle, lower eyelid, and upper eyelid. What is the function of lens? Focuses images on the retina, ciliary muscle, controls shape of the lens accommodation. Fovea, points of central focus, contains most of the cones. What is the function of retina? Contains photoreceptors. These are the accessory structures of the eye. This is the lacrimal gland, lacrimal ducts, lateral angle of eye. This is lateral angle of eye. This is lacrimal canaliculi, plica semilunaris, eyebrow, upper eyelid, upper eyelid or lower eyelid. Okay. This is a lacrimal sac, LS, or this is also nasolacrimal duct, NLD. Nasolacrimal duct. This is called medial angle of eye. Okay, come to the Stoker's line. Comes to the Stoker's line. The Stoker's line, mainly the key point is the accumulation of iron. The Stoker's line over the head of the pterygium in long standing stationary pterygium. Trachoma sequelae, trichiasis and pannus. Trichiasis and pannus. What is trichiasis? This word is very important, this trichiasis and pannus. Okay. Trichiasis and pannus. Trichiasis is a condition where eyelashes grow inward towards the eye, rubbing against the cornea or conjunctiva, which causes irritation, redness, tearing, light sensitivity, and potential corneal damage. This pannus in ophthalmic context, especially in trachoma, refers to abnormal blood vessels that grow into the cornea from the limbus, forming a vascularized overgrowth that can impair vision. Okay. Also known as pannus crassus. When thick and fleshy, it is a sign of chronic inflammation and often accompanies trichiasis in endemic areas. Okay, endemic areas. Trachoma sequelae, trichiasis and pannus. Okay. Yes, please let me know. Trichiasis, okay? Trichiasis, location, this is called trichiasis and anus, okay? What is the location of trichiasis? Eyelashes misdirected inward. Key point is eyelashes inward. Panus, corneal surface, vascular, inward, corneal surface. What is the main cause? Main cause, okay? Main cause. Eyelid scarring, inflammation, panus, chronic infection like trachoma. Symptoms. Symptoms of trichiasis: irritation, tearing, abrasion, vision haze in the panels, and corneal opacity in the panels. This is Goldman ablation tonometer. Goldman ablation tonometer. This is called as tonopen or handheld tonopen. Okay, used for scared corneas. What is tonopen? Often called tonopen is a handheld portable tonometer used by ophthalmic professionals to measure IOP. Okay, to measure IOP, that is intraocular pressure. To measure intraocular pressure. Okay, it applies gentle ablation to cornea after numbing with a topical aesthetics, providing quick digital reading via a beep and display, ideal for screening glaucoma or irregular pressure even in non-cooperative patients. So this is tonopen. This is glaucomatous field defect, inferior arcuate scotoma. What is glaucomatous field defect? Glaucomatous field defects are characteristics pattern of vision loss defected on visual field tests caused by damage to the optic nerve from glaucoma. These defects follow retinal nerve fiber bundle pathways, often starting subtly and progressing to the significant blind spots. This is gonioscopic view of the angle structure, that is squalbe lines. This is squalbe lines. This is non-pigmented trabecular meshwork. This is pigmented trabecular meshwork, scleral spur, and this is ciliary band. Okay. This is acute congestive glaucoma. Acute congestive glaucoma, cornea edematous and pupil mid dilated. Okay. See, normal disc, how normal disc looks like. Normal optic nerve head here. Here is glaucomatous cupping. This glaucomatous cupping. Ophthalmos. Here is ophthalmos, large hazy cornea, lacrimation present. Ophthalmos, large hazy cornea. You can see by yourself. This is called trabeculectomy blade. This is called trabeculectomy blade. See, trabeculectomy blade. This is called peripheral iridotomy, mid peripheral iris hole created by ND YAG laser in the SCG. Okay. What is peripheral iridotomy? Please have an overview. PI. Peripheral iridotomy is a laser producer laser procedure that creates a small hole in the mid-peripheral iris using an anti-YAG laser to treat or prevent angle closure glaucoma, ACG. Angle closure glaucoma, it allows aqueous humor. Aqueous humor allows aqueous humor to flow from behind the iris to the anterior chamber. Bypassing pupil block and opening the drainage angle to reduce intraocular pressure and avert acute attack. Okay, so come to the point, key point, very very important points. Okay, very very important points. This is the PI key steps of the PI. This is preparation, description, anesthetic drops, pilocarpine to thin the iris. Next, laser application. Laser application of NEET-YAG burst create a mid-peripheral hole. Creates mid-peripheral hole. Okay. Mid-peripheral hole. So after this procedure, what we do? Post check. That is post-operative checkup. Post check, IOP measurement, and anti-inflammatory drops. Okay. So drug is also given here. This is called adherent leucoma, iris plunging the defect in cornea. This is called anterior staphyloma. Anterior staphyloma. This is called ciliary staphyloma. Ciliary staphyloma, bulge at the ciliary body 2 to 3 mm away from the limbus. Most common cause are sclerotic and absolute glaucoma. Ciliary staphyloma is an outpouching, outpouching or bulge of weakened sclera overlying the ciliary body located 2 to 3 mm posterior to the limbus junction of cornea and sclera. It appears dark. Ectatic area due to uveal tissue protrusion through thin sclera, often bluish gray. Okay, often bluish gray. Basal cell carcinoma. This is called BCC. Most common lead skin carcinoma greater than 90% of the patient in nasal. Most common location infero. BCC of the eye is most common eyelid malignancy, typically appearing as a pearly nodule, ulcer or sore on the lower eyelid near the inner canthus. It grows slowly, rarely metastasis, but invades locally, risking vision loss or vital damage if untreated. Symptoms and risk factors. What is symptoms and risk factors? Symptoms and risk factors include persistent lumps with rolled edges, bleeding crusts, rolled edges, bleeding crusts, eyelid distortion, tearing or less loss, UV exposure, fair skin, and age over 60 years of old, increased risk, early detection via biopsy prevents deeper spread. Come to the main point. Key features of the basal cell carcinoma. Basal cell carcinoma. Key features of basal cell carcinoma. Okay. Details given here for the basal cell carcinoma. Location. Okay. Location, lower eyelid. BCC is generally in the lower eyelid, 50 to 60% in the local, and location is medial. Appearance, shiny nodules, crusty and shiny nodules, non-healing ulcer. Primary treatment, MOHS, surgery. Surgery, prognosis excellent with early intervention. Prognosis excellent with early intervention. This is called Hurtle's exophthalmos meter for proptosis kept at the lateral orbital rim. Okay, lateral orbital rim. Okay, lateral orbital rim. Okay, this is called this. Say lateral orbital rim. Okay, Hurtle's exophthalmometer. Yeah, it's very easy. See the picture. It's very easy. Right. This is the right lower lid chalazion, also known as tarsal cyst, also known as tarsal cyst. Below, okay, here, tarsal cyst. Meibomian cyst. It is generally painless, chronic granulomatous inflammation of the meibomian glands. Okay. Hordeolum. Hordeolum is generally called stye. What? It is called as stye, stye. This is called stye. This is called stye, also known as Hordeolum sternum. This is called lead lag. Lead. This lead. Okay. See, going down. Lead lag in thyroid ophthalmos. Okay. Ophthalmopathy. Also called von Graffi's sign. Von Graffi's sign. Okay. This is thyroid ophthalmopathy. This is called thyroid ophthalmopathy. Note, both eye lead retraction. Dalrymple signs. Yeah, very important to understand this. Diastichiasis or extra row of cilia. Diastichiasis. This is diastichiasis is double eyelashes, two type growth. Diastichiasis is an eyelash that grows in an abnormal direction. Okay, abnormal direction. See, this is the normal. This is normal in one direction. This is normal, and it is called healthy. But in diastichiasis is double eyelashes. Okay, see, double. Diastachiasis is an eyelid that grows in an abnormal direction. See, abnormal. Yeah. Leg of thalamus. Okay. Leg of thalamus. Generally, leg of thalamus due to seventh cranial palsy. Leg of thalamus. See, muscle involved, keratitis exposure, and ptosis due to third cranial nerves, normal and abnormal upper eyelid. Okay, falling the upper eyelid. Okay, muscle involved LPS. Okay. Leg of thalamus is the inability to fully close the eyelids. Leg of thalamus is inability to fully close the eyelids, often due to the facial nerve paralysis, scaring, or proptosis, leading to corneal exposure. It frequently manifests during sleep, nocturnal leg of thalamus, and can cause dry eye symptoms despite excessive tearing. Generally, come here, leg of thalamus. Types of leg of thalamus. Okay. Generally, mainly it is of three types: paralytic, cicatricial, and nocturnal. That is because of facial nerve damage, Bell's palsy, scarring from the injury, like cicatricial is scarring from the injury or surgery, or nocturnal incomplete sleep closure. Okay. Some others are very important. There are some others also. Types of leg of thalamus. So types: paralytic, cicatricial, mechanical, nocturnal, congenital. Okay, congenital. See here, type of leg of thalamus. It's generally example of paralytic is Bell's palsy. Key feature: muscle paralysis, cicatricial, scarring and trauma, eyelid contracture, mechanical proptosis or floppy lids, physical obstruction. Nocturnal, sleep related, eyes open at night. Nocturnal, congenital, Mobius syndrome from the birth. Okay. Come to the tarsorrhaphy. What is tarsorrhaphy? Tarsorrhaphy is a surgical procedure that partially or fully sutures the eyelids together to protect the cornea from the exposure, commonly used in leg of thalamus, facial paralysis, or severe dry eye. It narrows the palpebral fissure, reducing evaporation and adding healing in conditions like corneal ulcers or proptosis. So, tarsorrhaphy. This is tarsorrhaphy, partial permanent tarsorrhaphy. This is partial permanent tarsorrhaphy. This is lateral side generally of the eyelid in sutured closed. See, partial. Okay. This is total temporary tarsorrhaphy, but it is temporary. See, upper eyelid and lower eyelid totally closed. Okay. Posture protects the eyelid tissue. Eyelid is sutured completely to close it. Okay. Thank you very much for watching. This lecture. So try your best to improve your knowledge, because we don't believe in magic, we believe in logic. Okay. So try to pay more attention and get a lot of benefits from this video. I hope you all will get a lot of advantage from it. Try your best to memorize it and put your thumbnail, like, and share it with your friend. Thank you very much. Class is over now, finished. Bye bye.